To have osteoarthritis, I can tell you, is very, very painful. It is not only during the day when you're trying to walk around and be mobile, even at night time when I try to sleep. The pain is constant. I'm here to see Theo. He's going to have a look at my knees.
Mr. Pinkster?
Mr. Pinkster, yeah.
The osteoarthritis hip and knee service is designed to optimise the management of patients referred for hip and knee osteoarthritis by their GPs.
We were aware of the increased waiting list in this category of patient, and following the trials of the project in metropolitan hospitals in Melbourne, we were very keen to be the first regional hospital to provide this service.
The initial evaluation is a comprehensive assessment as well as filling in of a standardised questionnaire that was purposely developed for the osteoarthritis hip knee service. The questionnaire is resent at regular intervals, and any change, whether it be positive or negative, is noted and acted upon.
When I do the gardening, I find that I have difficulty when I'm whippersnipping.
I want to collect, I guess, as much information as I can so that I can understand the burden of arthritis on Alex as an individual.
So after 2 hours or so, I'm in real pain.
Can you tell me what medication you take for your pain?
I take Valium.
There's a lot of education about the correct use of medications. And if in fact we assess that pain is severe and significant, we can let the GPs know that they can potentially give them more stronger pain relief. So there's a lot of communication with GPs about that aspect of it. You can see on the inside of both the left and the right knee, the space between the two bones is a lot narrower.
Right.
And that usually indicates that your cartilage has become thin and your cushioning between the joints has narrowed, so you're getting more pressure on your bones.
Okay.
It's a typical feature of osteoarthritis. You also have... He is not keen or actually ready to proceed to knee replacement because he's still functioning quite well and his symptoms are relatively mild. Plus he has a lot of other contributing factors that haven't been addressed fully, so there is scope for a variety of non-operative measures that may be able to improve his symptoms and keep his function adequate and pain under control and potentially not need to have his knees replaced for quite a long time. The osteoarthritis hip and knee service is a multidisciplinary service. We understand that appropriate management of osteoarthritis requires lots of professionals and expertise. I'd like to refer you to the physiotherapist and exercise therapist at our rehabilitation campus for more strengthening and improvement in your general fitness and function.
Okay.
I'd like to have opinions of several professionals to try and optimise every aspect of your care.
So he put me in contact with James, who is also a physiotherapist.
So what I'll do is just do some little movements on the kneecap.
Who also assessed me and tried various exercises and manipulations of the knees. Just when you were pushing underneath.
Like that?
However,
I was also put in contact with a dietitian to lose some weight because that has an impact on my condition.
one of the things is about your alcohol intake, because alcohol has lots of calories and you're drinking about 3 to 4 glasses per day.
That's correct.
Yeah.
Being overweight significantly increased pain and disability with arthritis and also potentially progress the condition. And in Alex's case, his body mass index was 37, which puts him well and truly into the obesity range. So it's an important aspect for his particular care.
Just halfway, not too deep.
Okay. He also then put me in contact with Matt, and he supervises my gym work specifically for the knees to try and strengthen them or ease some of the tendons that the pain will be less.
So there was no swelling, increase in swelling?
It is a program that is under supervision in the gym work, in the hydrotherapy, and there is someone who says the progress is fine or no, we need to change tack and try something different.
We have noted from our review process that probably 2/3, 3/4 of our patients that were deferred from surgery improved the health status with the conservative measures that were instituted. The group that needed surgery, many of those patients have improved their hip and knee questionnaire scores as well. It essentially means that when they turn up for their surgery, they are fitter and more comfortable and have a better understanding of what is required to recover from their operation, and in fact are more likely to have a more rapid recovery.
The OAHKS service alone has halved our orthopaedic waiting list for patients to come into outpatients, which is amazing in 18 months. It's actually taken out those patients that don't need to go to surgery yet, so that they're seen by the physio rather than the surgeon. It decreases then those patients that go take up surgeons' time. So the surgeons are now seeing more patients, and they're seeing the patients that are likely to need surgery. When I sent out the patient satisfaction survey, they were just raving about how fantastic it was, how people spent time to listen to them, and how they were actually able to walk again and do things in the community. That's given them that ability to re-engage in life, because you get pain, you can become isolated. When you isolate them, it's a self-perpetuating problem. So to be able to give them options and give them things that they can do and ways to manage their pain gives them that benefit.
I feel it has made a difference. It has only been 3 months, but some of the pain is less, and I have certainly maintained some of the more of the mobility than I had in the past, and hopefully this will continue. And the idea is to hopefully avoid surgery, because I like to keep my own knees for as long as possible.